Welcome to our latest roundtable. My name is Ann Vasquez, CEO of EdSource. Almost 2 million California students became chronically absent since schools reopened in 2021 amid the pandemic. They are among millions of students across the nation who are missing what amounts to weeks of school. Since the pandemic, the number who are chronically absent has nearly doubled in California. At today's roundtable, we'll explore ways that schools can get students back to class despite the many challenges that have surfaced in recent years. Lastly, EdSource would like to thank the Lena Foundation for making today's roundtable possible. Now for our introductions. First, I'd like to welcome to our panel Hetty Chang, founder and executive director of Attendance Works, a national and statewide initiative aimed at advancing student success by dealing with chronic absence. Please also welcome Tom O'Malley, superintendent of Modoc Joint Unified School District in Alturas. Next, I'd like to introduce Erica Peterson, director of education and engagement for School Innovations and Achievement, a consulting group that works with school districts around the country, including more than 350 school districts in California. I'd also like to give a special welcome to Sophie Ryan, president of the Association of Pupil Services and Attendance Counselors in Los Angeles Unified School District. Please also welcome Renees Slater, the mother of an 8th grade student who was chronically absent last school year while attending a public school in Bakersfield. Our moderator today is EdSource reporter Betty Marquez Rosadas. Betty, I'll pass the mic to you.
Hi, everyone, and thank you for joining. I'd like to start with Hetty to share some context. Hetty, you were looking at chronic absenteeism before the pandemic. Can you tell us what you found in the data on chronic absenteeism during the 2021-22 school year and who it has most impacted?
Yeah, and let me give a little context also nationally. So nationally, we had about 8 million kids chronically absent before the pandemic. That was about 16% of kids, and nationally we're seeing almost the doubling that Anne referenced. In California, though, actually, we more than doubled. We went from 12% to 30%. And when you look at that data by grade level, it was 40% of our kindergartners in the 21-22 school year. So that was the grade with the highest level. I will also say there are some challenges around our middle and high school data because we base our funding based on average daily attendance. And so districts tend to count kids as being there if they just show up one period. So it looks not as bad in the high school levels, but we actually may be somewhat undercounting the kids who are missing 10% or more of school. There are certain groups that have been disproportionately affected. Native American students, African American students, Latino students, Pacific Islanders are disproportionately affected. But then if you also look at who makes up chronically absent kids, you'll see that almost 2/3 of the chronically absent kids in California are actually Latino. We've seen an enormous increase among English language learners. Something happened during the pandemic that really affected our ability to communicate well with families who speak languages other than English. And you also see that a huge disproportionality among the number of kids who are actually special ed, kids with disabilities who are chronically absent. Certainly there are pockets like kids who are homeless and who are in foster care who have high levels. But when you look at sort of where the large numbers of kids, really, I think we have to focus on what's happening among some of our EL and our Latino kids who make up such a large number, as well, again, the Native American, African American students. What I would also say is that, and I would really love to turn it over to Erica because so data in California is a little delayed. School districts capture it all the time, but then they're still turning that data into the state. And we won't know the 22-23 numbers until probably December of this year is when it gets released. But Erica has some insights into that. And I do want to say that knowing prior year and first month school chronic absence is really important, because the kids who are most at risk for being chronically absent this current school year are the ones that were chronically absent last year. And I'm a little worried that sometimes people think this is, it was just an aspect of COVID. And now that we're sort of through where COVID's endemic and not as big of an issue, it's all going to go back to normal. And I'm really concerned that that's not necessarily the case. But Erica, maybe you can share what you've seen.
Absolutely. Thank you, Hetty. And you're actually right, unfortunately, in the sense that we did not see the large drops in the 22-23 school year that we would have hoped. So at School Innovations and Achievement, we do work with districts across the state on attendance. And so we are collecting data in real time from the districts that we partner with. And so having looked at a subset of our district partners, what we saw is that most of them still stayed pretty much around, I think it was about a 2.7% drop year over year from 21-22 to 22-23. So we're still at record high numbers and elevated numbers across the state for chronic absenteeism. And Hetty, you mentioned the sort of profound impact of high rates of absenteeism in kindergarten. And that's also what we saw in the current year, is that we did see declines, right? So where did that improvement of about 2 to 3% come from? Well, we saw improvements across the board for our data set across all grade levels, except kindergarten was the only grade where we saw persistent elevated rates. They're the only rate that did not go down for us. So this is definitely a challenge, and many of the trends that you spoke to for last year have persisted in the face of the fact that we are supposedly quote unquote back to normal. Many of the restrictions around masking and quarantines have been lifted, and it is still a challenge for all LEAs to really reinvigorate and rebuild the habits of getting kids to come to school.
I agree with you. Yes, I agree with you. And one of the challenges that I have as a child welfare and attendance counselor is also when you look at the data, thinking on the accuracy of the data. Because yes, Sophie may have missed 20 days of school, but we sent her home 10 days. And then she got sick again and she got 5 more days. So when you're looking at numbers, there was a high rise of students who began to have chronic absenteeism because of the illness. And you have to respect confidentiality, and you cannot say, oh, COVID absences, this many. You just say illness absences. So it's challenging to get numbers that reflect the realities. And I do agree with everything you have said, especially about the kindergarten students.
Thank you for those additions. I do want to, throughout the conversation, come back around to what just districts have been doing and what more they can do just across the state. But I want to turn to Renee and talk about a little bit about your own experience. You're a teacher. Your daughter is also, she's entering 8th grade. She's a straight A student. She's involved in school activities, and she had great attendance, up until last year. So can you share a little bit about your experience? What do you think changed for her? And how has perhaps the support at home helped her stay on track with her schoolwork despite having that chronic absenteeism?
Well, I think for her and the other students, I think there's been a little bit of a disconnect with school because we've been masked. Last year was the first year without masks, but there still wasn't that community building because we had to stay separate for so long. I think sometimes for her, because she is a straight A student, she's very high. Her last reading test came in above 11th grade, so like it's very easy for her to get caught up. We also have great internet at home. We have computer that she can use. So it's very easy for her to look. Middle school, where a lot of us are using Google Classroom. I know the high school districts are using Canvas. So it's easy if you have access to that to get caught back up. My other students, because our district is very diverse, my other students who have not very good internet access at home, that don't have access to a Chromebook, I saw them when they were chronically absent falling farther and farther behind. And so I could open up my classroom, but what child wants to come in at lunch to make up their work? So they're already at a disadvantage, or they're already behind academically, and the pandemic just made it worse. The Latino families are the ones that we tend to be a little bit more socioeconomically disadvantaged in our school district. And there's an area at our school district that internet is not good. The high school district would send a bus out there for internet during COVID, but now that COVID's over, that's gone. But teachers have changed the way they teach, and they're much more digital nowadays. So that does. So personally, I believe that the internet is the new electricity from like the 1920s and 30s when we were trying to get, electricity to everybody. Like, I feel like that infrastructure needs to be prioritized so that everybody has access to good internet for education, for college, because that's what is the world is going that way. I don't know if that answered all the questions, but
thank you, Renee.
Yeah.
I want to turn over to Tom. It's day 2 of the school year today, and you lead one of the state's many rural districts. What are some of the reasons that students in your district are chronically absent? And if you could also please share some specific solutions that you have found to work. I know you've made some staff changes in recent years, so I'd love it if you could share some of that.
Sure. Just being as remote as we are, we're about 150 miles away from the nearest city. So I have parents who have to go to Redding, California, which is again 150 miles, to have their kids' braces checked, once a month, and that's a day trip for us, because when you go to the city, you go to Costco and you get new clothes and you do whatever you need to do. So you look at that child right there. That's a child that's out 10 days, because they got to go once a month to get these things tightened. So throw in a couple of illnesses and a couple family trips, and you're chronically absent. So otherwise, you've had kind of a normal school year, and that's just something that we have to embrace and accept. I don't, we're never going to get a chronic absenteeism rate. I'm hoping we get down to like 16%. I think that's fair. I don't see us ever getting below that because of where we live. That being said, we have the staff changes you were alluded to. Our school nurse, we use COVID funds to get her up to a family nurse practitioner. So ideally, we can provide some medical services here. Our lack of medical services is fairly extreme. So, my doctor's in Roseville. So, it's a long drive. So if we can do some of those things in-house and keep kids healthy, keep them in school, now I've got someone on campus who can prescribe medication, who can see kids, all with, parental consent and what have you. But that's been something that we're just stepping into the pool on this. So she's just finishing up her certifications now. That's kind of been the biggest thing we did. We hired her to basically track individual attendance of our kind of, red flag students, and just we try to immerse ourselves in their lives and really, kind of get to the root problem, and having that employee that is dedicated to working with families and having those conversations, that has been helpful. And prior to COVID, we were 27.9 in 18-19 as far as our chronic absenteeism, and we were projecting to have that down to around 17% before COVID hit. So us just spending time with individual families on a case-by-case basis and working with them seemed to help.
Building off of your comments, Tom, there's a question in the audience, and maybe we can open it up to other panelists, about how are students who are chronically absent, who do return, the ones you are able to identify, how are they evaluated? What are the services or supports that they're given at that time? Is it about working with parents? Is it about providing health care? If you guys can give some insight.
For me, it's the individual students. So, my daughter was chronically absent. She was a valedictorian. She played club volleyball 100 miles away 3 days a week and on weekends. So she missed a lot of school, but it is what it is. So she didn't need any assistance. She was fine. But then again, you have those other kids who, are raising their, you have a third grader who's raising their first grade sibling and their kindergarten sibling and making sure they get to school and doing whatever else and trying their best while their parents, are passed out on the couch or whatever the case may be. Totally different scenario, totally different set of interventions. So every case is different. I don't think there's a one size fits all personally.
Might I offer So this is insights from another state, but this is the Connecticut is a state that we've partnered with for a long time. And as a state, they collected chronic absence data every month from school districts so that they could manage throughout the pandemic. And they realized early in the pandemic, like winter of 21, that they had a chronic absence challenge. And what they realized is, well, it's not that you can always predict every single intervention. Someone going out to the home, talking with families, finding out what's going on, and then sometimes it's a light touch. I just need to get them to connect to their teacher. And sometimes they do need health services, but they called them LEAP home visits, the learner engagement and attendance program. And by doing home visits to chronically absent kids, they were able to improve attendance by 15 percentage points compared to kids who did not get that intervention. Now, in Connecticut, it's also true that they've, as a state, invested in once a school or a district has over a certain percentage of kids who are chronically absent, they're supposed to have a team that's putting in place a multi-tiered approach so that you have tier 1 interventions that make sure school's a fun place that you want to be, and then you're using this as a tier 2 support for the kids who need something more. And part of why they use their data so well is they had the foresight to see there are also things called parent-teacher home visits, and it's a fabulous program of teachers doing home visits, but they worried because they were having, like all the rest of us, teachers were exhausted and tired and didn't necessarily have the bandwidth. So they used their data to figure out where they needed to expand resources so you could do that kind of home visiting.
This segues perfectly over to that question for Sophie that I have regarding any techniques that have been implemented at LA Unified. Could you please share what that has looked like there?
Yes, so I want to add to the last comment that in LA, we are child welfare and attendance counselors. And what we have been doing, and we create interventions by bands, and we have a lot of data reviewing, so that we can do the interventions. And as child welfare and attendance counselors, we do home visits, whole child assessments, family support, linkages to basic needs or anything that the family may need, to ensure that we address all the barriers that are preventing the children from being in school. And very importantly, the pandemic opened everybody's eyes and highlighted child welfare and the need to have students addressing family structure and student needs, because we learned during the pandemic that many children had not an English speaker taking care of them. For example, we had parents who left home at 4 a.m. to return about 11 o'clock at night because they have 2 jobs, and pretty much there is someone that the child may reach for an emergency, but not someone who can supervise and provide support. So we have a lot of support because we also have staff. We have the most important advice that I can give to the people who are listening and who want to get engaged is, please make sure that you have working phone numbers, because when you talk about connectivity, it's not only about internet connectivity. Boy, if I had a penny for each time I call a parent and I get the number is disconnected, I would be, Bill Gates, move over. I would be really rich. So it's important to have this connectivity to make sure that you know the teacher's name, the services that the school has, because we have a lot of support and you just need to make sure to connect. So my best advice is to connect.
I think some of the other things too, we focus so much on chronic absenteeism, and while it's a really important indicator, it's really looking at what we're doing to prevent and get in front of, and how we're messaging to families about school safety. Sophie, you talk about. So as we see some of these high numbers in early grades, there's an opportunity to educate parents that are new to the school system, and an opportunity before their child is in need of interventions, talking about we want you here. The importance of school. Kindergarten's not all finger painting and nap time, right? I think that that's another thing that is working, is that we have seen in our data for districts that take a proactive approach to educating and communicating with parents, to set the expectations, to provide, as Sophie said, what resources are available, not in the face of, well, now you're deficient in attendance and here's what we can do for you, but up front saying, here are the things that we can do. Let us know how we can help you. And I think that that's a place too that's often not talked about, but that is working for districts that do those types of approaches.
Absolutely. And when you look at that, we are very, very fortunate to have a superintendent who is really in tune with child welfare. So we have had a lot of changing when it comes to welcoming environments. We make sure that our schools are friendly, affirming, inclusive, and schools that provide a lot of support to the families. One of the issues that I learned that is also impacting attendance is the availability of after-school programs, because sometimes parents don't bring the child because there is nobody who's going to be taking care of the child, picking them up, or because there is nowhere they can wait for the child to come out from work. So when you do the assessment and you really think of the whole child, you're going to really learn what we need and how to take care of it. Our superintendent also found out that it's important to have more transportation, and he provided more buses. We have, I think, like also the largest fleet at this time. So the needs assessments are very important to make sure that families are getting child welfare support.
There's a question in the audience, and I wanted to throw it out to the group, regarding in those districts and certain classrooms, and particularly at the secondary level, where attendance is required or part of the grade. What are your thoughts on that as a way to stem this issue? Clearly, there's been mention about not every student's circumstances are the same. What about that notion of requiring attendance as part of the grade?
And I think it's wrong. It's an equity issue, because sometimes it's the parent's fault. And if the child doesn't have a driver's license and is not in control of their situation, they shouldn't be punished for it. I do feel like the purpose of, I think the grading system is a little bit outdated. Like, is the child meeting standards, like these standards that we've proposed? So that's just my opinion. I don't know how the rest of the panelists feels about it, but really education is an equity issue. It's the great equalizer as far as kids that are disadvantaged. Like, we are trying to help everyone, whether that be career or college, because that's the purpose of an education. It's not for everyone to go on to college. It's to provide a place for everyone after school. What do you do long term? So I don't know. That's just my opinion.
So we did that for an extended period. We, in my high school, ran with, you had to be physically present for 90% of the school year, or else you failed the class. And what we found was we picked up 1,000 days of attendance in the first year, the first time we ran it. And there was a whole appeal process so we could evaluate individual kids who were actually, were that 10% chronically absent. So we could look at them and just make sure, those instances that Renee brought up weren't occurring. And what we found was out of an entire senior class, because those are the ones we were most focused on, which for us is about 60 kids, 60 to 80. There were 2 kids that this actually applied to, and they were failing all their classes anyway. What it did was get all of our kids who have good grades, it got them to actually show up consistently. It was kind of an interesting phenomena. So that's what we did with that.
So beside the legalities of doing something like that, what I see is that if you keep a punitive approach, you're not going to solve a problem. I think that we need to continue to focus on ways to find a balance. And our goal is to let everybody in, to promote the academics, right? So what can I do? May I need sometimes a hybrid situation if I need an independent studies situation for this particular child? Let's do it. The goal should be to see what do they need and what can we do to make sure the child gets an education.
I just wanted to interject and say that that's what I was trying to say. So I 100% agree with you. And, you know, I've never had a child tell me, oh, that was a great lesson that you gave. But I've had students come back and, you know, tell me, you know, that they miss me or this, because it's not what lessons you're teaching them, it's how you make them feel. And our school district is really committed on that front end, like you guys were saying, about catching them first by trying to create an environment where the kids want to come every day. When I make parent phone calls, I try to kind of make them feel more relaxed. Like, okay, so your child's missing a lot of assignments. What can we do? Let's make it a problem solving rather than me get onto them. Why aren't you checking your child's grades, and make it punitive? Because you're right. You set people off and they're not willing to work with you if the blaming, because, okay, so this happened, what can we do about it?
And we have so many studies that show that many kids come to school because they have a connection with an adult in the school site. So look at so many stories in Instagram now that we have access to all these social media. When you look at graduation days and you see the custodian high-fiving a line of students who said, I really felt safe and I had this connection with this particular individual, not necessarily the teacher or the counselor. But when you have a welcoming environment where students feel connected and they feel safe, you're going to have an increase in attendance.
There's a public health approach when it comes to this conversation as well. And I know, Hetty, you've spoken to this in the past. So can you speak to ways that school districts may be able to implement this framework?
Yeah, and let me just add, there actually isn't much research that says a punitive approach works. Most of the research that's looked at whether it's, I think even the system that we have, which is you eventually take kids to court for unexcused absences, there's not much evidence that actually that improves. In fact, there's some evidence that it can make attendance worse. The key to solving chronic absence and attendance is understand what are the underlying issues that are causing them. Is it barriers in the community? Is it the fact that school is creating, kids are feeling aversion, they actually are pushed out, or kids aren't feeling engaged in school, or kids have misconceptions. And I think that even that example of what you gave, Tom, it'd be interesting to sort out how much is because now you help kids understand the importance of attendance to future and making sure they come. Can you improve attendance versus just using grades is one way to convey it, but there may be multiple ways to convey. And there's certainly sometimes kids don't recognize the value of that. And part of why we advocate for a public health approach is that there's a whole set of things that we can do to lay that foundation that makes kids want to come to school, which we talk about as positive conditions for learning. Do kids feel that school is physically healthy and emotionally safe? Is school that belonging, connection, and sense of support? Is it school is engaging, and are they surrounded by adults and kids that can that will support that relationship building? And when we have the high levels of chronic absence that we have now, it's actually an indication that we're failing to put in place those positive conditions. And a public health approach is really about saying, well, if we don't invest in those basic underlying conditions, even like if you say to a kid, oh, you missed 10 days, you need to come back. If they don't feel like school is a place that's going to get them to a different future, they may not feel that coming back is worth it. And so when schools can actually take and map out what do they have. Sometimes you can even we have something called the SEAT tool. It's a scan of environment and attendance tool. And you walk through a building and you can just see what is it like when you're walking into that building? How are kids connected? What's the relationships? Do kids feel that their work is being honored? Is there messaging around attendance? And then you can go from doing that to making sure that you're using your communications, like texting with parents to say, do they get informed immediately? Sophie wasn't there yesterday. Is she okay? How can we help you? So that they feel noticed, but also you get information. And when you put in place those tiers, the most expensive tiers are top tiers, taking kids to court, intensive case management. And in fact, we don't have resources to do that intensive work for thousands of kids. So if we can put in place those underlying prevention-oriented supports, then we can actually manage a system that will really ensure that fewer kids are chronically absent and more kids are succeeding and doing well, which is the ultimate goal.
I really wish all schools had a child welfare and attendance counselor, because we provide linkages to all sorts of services in the communities, clinics, you name it. So I feel it's really difficult for schools that don't have enough support staff to try to do all this community connecting. And I just want everybody to make sure, check who is who. Who is the person in your school site that you can talk to about receiving referrals? Because the school districts have found nurses, volunteers, and other out of the classroom staff who help parents to make sure that children receive services. So please check.
And Sophie, I actually think there's a dual part. There's both how do we bring more people into schools to help them, but some of it too is how do we stop doing things that get in the way. And let me give an example. A lot of times when you have excused versus unexcused absences, if absences are unexcused, kids get treated differently. Sometimes in some places, if it's an unexcused absence, teachers aren't required to help kids make up for the lost opportunity in the classroom. They can't take the test. They can't turn in the homework. It actually can cause teachers to look a little differently at kids because there's sort of this sense that this kid didn't want to be there. And then we often have notice of truancy, of which, part of the required language right now in California is if I send a notice of truancy, I'm going to tell them that I might threaten you with court eventually because you didn't show up. But sometimes what's excused versus unexcused can be a little arbitrary. 2 kids are sick. They're both out 5 days. One kid doesn't have access to health care. And so then they get considered unexcused. And there's evidence from California's data that kids who are lower income are much more likely to have unexcused absences, which sometimes, I'm not saying there aren't some kids for whom they may be willfully missing school and you actually need to apply some kind of consequences. It's just that often we haven't put in place a system to identify the kids who aren't willfully skipping school. There's something going on, and so then we're not solving it. And then we alienate the family by sending negative messages and even sending negative truancy notifications. And if we can start with a much more positive approach, I think we can reach many more students and families. And then we also have to make sure that we are having those partnerships so more people are on board. We're not just leaving it to our schools to be able to resolve the hurdles that keep kids from getting to school.
And
thank you for that. Oh, sorry, go ahead.
Sorry. And that's why it's important that you have a qualified employee reviewing the data. Because when we look at the amount of the absences, we look at what happened the year before, we look at the type of absences, and when they are in excess because of illnesses, the first thing that we say when we call parents is, I'm here to help you, and I need to see what it is that we need to make sure that you or your family are receiving, or your child are receiving services, because You would be surprised to know how many kids are missing school because the parent gets sick and they cannot take them to school, or they need to take care of the parent. So having that ability to navigate through the data, to approach the families, providing support, and with the goal to empower families, provide them support and help the child to come back is really important. I totally agree with you.
So one
Thank you for
thing
that.
my school district has done with our limited resources is we're doing Wednesday Hub Day. So all the students come for a lesson, 30 minutes to their first period. So their first period teacher they're kind of like supposed to be like their first go-to. So we're creating a community, so that first line of defense. So we have lessons and things for the kids to get to know each other. The kids get to know their teacher, teach empathy, and teach a sense of community. So I'm hoping, I'd like to see how that ends at the end of the year, but I have high hopes for it. And the kids we did our first one on Wednesday, and the kids were really excited about it, and so were the teachers, because usually you don't always get buy-in from teachers. But this program seems to be getting off to a good start.
We know the pandemic had an impact on students at all grade levels, but probably those earlier grades and the younger, in some cases, the more difficulties that students had in terms of returning to school. For kindergartners, we've seen a trend of, at least here in California, of either students who are, delayed in attending kindergarten or just not showing up. And so curious to know from you all your thoughts on why they aren't.
I would say it's, kindergarten's not required. So it's hard to hold parents accountable when they're not required to put that kid in class. So until that gets rectified, those K numbers have always been low, and they always will be, because there's an easy out. I don't have to send my kid.
Not only that, but I think there's an opportunity. When you think of kindergarten parents, they're maybe younger, first time in the school system. And I don't think that expectations are always clearly stated and upfront. As a parent, how did you know what was expected of you around your child's attendance or coming to school or what's going to happen? And I think there's a lot of opportunity to educate parents, especially of early and young learners, about the critical foundational skills that are laid down in early grades. But I don't think parents know that. I said it earlier about finger painting and nap time, but I think that there is some belief that is some of what is happening in kindergarten. And as Tom said, since it's not required, and maybe there's some hesitancy over health concerns, as Hetty was talking about having a public health approach. So this is where we have this opportunity to really lead with educating parents early and communicating with them often. Again, while we know that there are interventions in place around kids missing school, the first notification of truancy goes out, et cetera, but what are we doing throughout the year to make sure that we stay connected with parents in this, whether there's absences or not, around why coming to school and showing up is important? And what we've seen, at least with the districts that we work with, the more that we reinforce and educate parents, we are seeing a difference made in those early grades, in terms of constantly communicating with them above and beyond, again, the intervention, but with positive, proactive resources, what opportunities are available, educating parents on the importance of attendance does and can make a difference for those particular grade levels.
I also just want to make a comment that one of the best strategies for improving kindergarten attendance was kids going to preschool. And one of the things that it does is it helps kids and families get into a routine of going to school. It also, I think that, so one of the reasons you're seeing high levels of chronic absence right now is our preschool systems have not recovered from the pandemic. And there aren't even as many slots to meet the need of the amount of kids who go into preschool. And so we're also sending a message when we're not having sufficient early education that this is kind of an optional thing, not an essential thing. And in addition, I think there's been some challenges with making sure that families understand what is going on. As you said, Erica, they may not understand what's the value of what's being learned and how showing up every day matters. But part of that is because when schools opened up, they didn't open back up for parents. They opened up for kids, and parents are now, you just drop it at the door and they don't see what's happening in the classroom. And now they also haven't had their kids in preschool experiences where they might have understood the value and what you get from early learning. So we have an opportunity. Like sometimes I'll talk to folks and they'll say, well, I can't say anything to the parents because it's kindergarten, it's not mandatory. You can talk to parents about the value and what you get. Threatening families with court is probably not going to get them to show to school. Although I do think when we've made things mandatory, people realize that it's a priority, but we need to find other ways to explain the priority of showing up to school in kindergarten, what it gets kids in terms of their long-term success, and why showing up every day actually matters for their well-being and health, and then their long-term success in school.
And you were mentioning on the strategies that we have. So our superintendent has always been focusing on engagement, parental engagement. So we have parent academies and we have community schools. And there is a lot of emphasis on having more coffee with the principal, resource fair, after school activities where parents can come in and get to know other teachers, get to participate, get to feel welcome and connected, in addition to having workshops and everything else that we can do to educate families. So yes, engagement is really important.
Based on your working directly with 356 districts, Erica, I want to, just taking this just conversation that you all have been having, do you have a sense of when educators or perhaps researchers believe some of the impacts of this pandemic might begin to diminish?
Gosh, that's a great question. And don't we all wish we knew the definitive answer to that, right? I mean, we don't necessarily have the crystal ball to say. I think many of us thought this last school year that elapsed, things would have recovered so much more than they did. But I do think that what we're seeing is that this has to be a long-term approach. That recovery from the effects of the pandemic is going to take investments around these strategies, around these perspectives, and this focus on getting kids to come to school and supporting them and getting behind the why of absenteeism is going to have to be ongoing and persistent. So, I have in the past, gone on the record to say, 3 to 5 years is really kind of what I think it could be. I do believe there's a bubble. And I also believe that there are some families that won't recover because of maybe catastrophic impacts, right? We have to remember that some students lost family members or had job loss that led to a homelessness. So, but as far as learning recovery and kind of where we might be from an absenteeism and academic outcomes, it does need to be, we need to play the long game here. And so that's really the best guess that I can give based on what we've been seeing in the data and the patterns that have persisted.
And this next question goes for anyone in the group, but we've talked about some solutions, some techniques, some different ways that districts are trying to get students back into the classroom more regularly. I'm wondering, based on your experiences with that, when should districts keep on trying these techniques to see if being persistent with them will work, or when should districts perhaps try something new or adjust? I'm thinking about, Sophie, Tom, the other strategies that have been implemented. Are those the same that will be implemented going into this new school year, or are new strategies going to be tested out?
Okay, I'll go. Sorry, Sophie, I thought you were going to go. We're pretty confident with the systems we have in place currently. So, we call them TPTs, truancy prevention teams. They meet with individual families when we start seeing those numbers creep up and And just, again, that individual one-on-one contact and trying to get to root causes of absences in each individual instance has been effective for us. And that's what we'll continue to do. The problem obviously is employees, and none of us have enough, right? So do we have enough time to get them all? And that's going to be the hard part. And that's where you start looking at, in all honesty, the high school kids, and some of them their parents can't control, and so we start diverting a lot more resources to the younger kids where we think we can have more of an impact, and those kind of decisions are made. But right now, just our constant involvement on a case-by-case basis seems to be effective.
Yes. Our district has been Lena Foundation, and we continue to evolve because the assessment is a monthly assessment, a weekly assessment, and the strategies continue to modify. We have now more emphasis on attendance teams. We have more emphasis on child welfare, promoting child welfare, connectivity, and parent engagement. So the silver lining of the pandemic was that it helps so that people would not see schools as where kids go to get the ABCs and the 1, 2, 3s, but where you have the experience of supporting the whole child. And you have psychiatric social workers, child welfare and attendance counselors, where we promote social emotional development, where we can help families, and where you can also understand the need of having more services for special education, where you need more services for mental health. So we continue to do assessments. We continue to improve depending on what works, what hasn't worked, and we're open. We are open to team up with parents so that we can help kids.
There have been a few questions in the audience about students experiencing homelessness and how to connect and reach and help those students. Thoughts from anyone on the panel?
I have to say, I don't like to monopolize the conversation, but I'm so excited because we have a unit, the homeless unit. And this homeless unit has child welfare and attendance counselors that do a lot of outreach and that help students because we have reached out for funding and we can help for emergency situations, clothing, backpacks, referrals for services in the community, referrals for social services, housing, you name it. So LAUSD has also an app. So if a parent goes to the LAUSD app, they can also look into how to connect with the homeless unit. And we have a lot to offer.
I would just add a couple things so there's some work done by the National Center for Youth Law, and they have something called Foster Ed. And what they found improved attendance for homelessness or kids in deep systems is that they would create a team. The team includes one person from the system, so from the child welfare system, one person from the school setting, and one person in the larger family or connected who can help to navigate a student through, and where they all have, like in New York City, when they had addressed the issues for homelessness, it's partly because they created a data system. So when kids were in homeless shelters, the folks in the homeless shelters could have access to kids' attendance data and their academic data, and they could provide support. When you're talking about kids in deep end systems, you need to ensure sharing of data, trusted relationships, dealing with the confidentiality, but that you need a team that can cross the systems because kids are navigating so many different issues. I also wanted to offer up, Anne, that I saw a lot of questions about transportation. And this has certainly been definitely a challenge. Our public transportation systems aren't necessarily back to normal, but one of the things that we've seen some communities doing in a more creative way is that they've tried to look at the transportation issues from a bigger systems issue. So looking at what's happening with after school, charter school, and the public school district, mapping out all the different transportation options, whether that's buses, whether that's carpool rides, whether that's using apps, and then figuring out. And so in some cases, they've actually created buses that for one period of the tape, they were helping with the churches. And then they were doing the work on the after school. And then they were working and supporting transportation in the charter schools, because what they found was people actually had different needs and times. And if they could co-invest in the van system, they could actually improve attendance. But sometimes because we try to solve problems too singly within too narrow of a band, we're not actually looking at the resources and the options for collaboration that could create a different kind of innovative solution.
Yes, and LAUSD also has child welfare and attendance counselors who support foster youth. So please go to the lausd.org webpage, then check PSA unit and hit homeless or foster youth, and you will get all the information you need.
I know that transportation it's something that came up in a conversation, Renee, that you and I had previously when we initially spoke for the story on chronic absenteeism, that some of the students who might have the option of staying after school sometimes can't because they need to get on the school transportation to get back home. Otherwise, there's not many other options. Can you speak more to that?
We are a rural school. A lot of our students do come from an urban type setting, but you have to take a bus to get here or you have to be driven here. We are not a neighborhood school. We are surrounded by almond orchards. So students like my daughter are able to participate in after school activities because I can transport her. But other children whose parents work late might not have those same opportunities. And so that is something that I know my superintendent has really thought about, is how to make things equitable. And that's really our focus this year. And that's why we're doing these hub time, just so that teachers make those connections and things, and how to solve that problem. Because we have a rich tradition of after school sports and other traditions at our school, but how do you open that up for the student that might not have transportation? We still haven't solved that. So Hetty, if you've got an idea, I'd love to hear it.
Well, I think that we also face financial challenges, right, to address transportation. Something amazing that Superintendent Carvalho had done is that when he started to design the strategic plan, he had needs assessments conducted, and he increased the areas where students will receive transportation services. And also he's working into providing concierge transportation for after school programs. So we are working on trying to solve that issue and to create more attendance support with transportation.
And I think there may be real variations between what a large district like LA Unified that has lots of systems and very small, tiny rural districts where the resourcing just isn't the same. So one other thing I think that we do really encourage is we have this thing called student attendance success plans that have a help bank. Now this is on a much more, where you get every family in a school and a community to kind of think about who's their help, who gets them to school every day, who gets them to school occasionally. How do you come up with those backup plans? And then how do you create those community activities that might encourage families to know each other? In some places, we may not be able to come up with a paid solution from a school district system. And I think the question is, how do we leverage the informal networks of support? And that is one of the things that I think rural areas really often have a strength in. People know each other. communities connect to each other. There's a trust that you might be able to build on, but maybe they're not as connected, or having thought before they have a challenge with transportation, where might be there 3 or 4 other people who could actually do that carpool.
And I think just speaking to the lack of resources in our school district, as opposed to LA Unified, we don't have counselors. That's not something we can afford. We did add another school psychologist, so there's one at each site. But speaking to students who still have some social emotional baggage from the pandemic, our resources are limited. Our nurse, we're 1,000 school district. Our nurse is pulled in several different directions, so he doesn't really have the time or resources for that. So like I said, our district is really focusing on that first wall with our hub time on Wednesdays and teachers making connections. And I know we're all on board, and I'm just really excited to see how that improves engagement and students coming to school.
And Renee, another option that maybe could help rural areas, going back to some of the virtual pieces, but they've seen that when you use health services that are provided virtually, it can actually improve attendance, because sometimes you can have folks who are, you can't have the specialist, but you can, as Superintendent O'Malley has done, have a school nurse who can help with some of the basic pieces, and then you use virtual health services to be able to get kids to needed supports without them actually having to travel so far. So at least you're improving attendance, because now kids aren't going quite so far to get their health related services. And that might also be a resource for mental health. Not that it will work for every situation, but I think if we can improve internet, as you said, Renee, it's like the new electricity. It also can expand access to students and families, to supports and services that reduce the barriers and reduce the transportation costs.
We're coming up on 5 p.m. right now. Thank you so much for all of your insights in this conversation. Are there any last things that you have in mind that you would like to share before we close up the conversation?
I want to say, think about prevention, think about engagement, and make sure that you know who your teacher is, make sure who is responsible for providing parent support, and please make sure the school has a way to connect in with you, having current information in your emergency card. And thank you, everybody.
Well, thank you, everyone. I would really like to give a special thanks to all of our panelists, to Betty for great moderating, for those working behind the scenes, helping answer the many questions that we've received throughout the hour. And a big thanks to the Chamberlain Foundation for making today's conversation possible. Thank you, everyone.